Well, welcome to this YouTube video. I'm Niall Walker. I own an insurance agency in Western Washington and the greater Seattle area. And today I'm going to visit with you a little bit about Medicare. I've owned an agency for the last 20 years. I've been in the insurance industry for 40 years. And for years I have been involved in providing my commercial clients group health plans and have been constantly asked about what is Medicare, how does it work. I have employees or as an owner I'm now getting to the age where I need to consider Medicare and become enrolled into Medicare. So about 6 or 7 years ago, finally decided, okay, I should probably find out because I have so many clients that were asking and I just had no idea. And I think it's also motivated because now I'm becoming the age to where I'm going to have to start considering that for myself as well. So I began to do some little bit of research and get some training and to begin to understand what Medicare does and how it works. So today I want to just share with you information about original Medicare Part A and Part B, and we'll discuss Part D very briefly, and Part C, which is something that has been introduced to Medicare within the last 15 years about. So anyway, well, let me visit with you about that, and hopefully I'll answer some of your questions. And then I'll do two separate YouTube videos, one addressing Medicare Original with a Medicare Supplement and the prescription drug Part D plan in addition to that. And then I'll also have another video that will discuss what Medicare Part D or Medicare Part C or Medicare Advantage is, and I'll go in detail with how that particular option under Medicare works, so that by the time you're done, you'll understand what original Medicare provides for you, why you would consider supplementing that original Medicare with something, whether that supplement is deciding to add a Medicare Medicare supplement or Medigap plan, or whether it's choosing the Medicare Part C or Medicare Advantage. So anyway, let's talk about Medicare Original. When you turn 65, you become eligible for Medicare if you have been providing and paying in Medicare taxes as an employee. There are specific rules about how long you have to pay to be eligible, and it also what you pay in Medicare premium may also be determined about the income that you currently are making after you're retiring. So those kind of information is available. You can go to medicare.gov and they'll give you some information about that. If you go to medicare.gov, you're going to find there's a tremendous amount of information. Hard to really fully understand what they're talking about, even as an agent. In some ways, been in the insurance industry for years. It's kind of difficult to go through and take a look at what material's there and be able to define exactly what it's being applied to. So please look there at medicare.gov, but you may find that it may be a little confusing. So Medicare Part A is the portion of the prescription or the doctor's care or medical care that you receive that's in the hospital. So Medicare Part A only pays for hospitalization charges. You have to be admitted into the hospital for it to pay, and it pays for the doctor, the surgeon that's part of that hospital stay, and the doctor is part of that. It pays for the hospital bill itself, and any other services you have that's part of the hospitalization stay. Now, Part A has no premium. So when you enroll in Medicare and you're enrolled in Part A, you do not pay the government any type of premium for that. It's just included in your benefits. Now, what Medicare Part A pays? Well, you are responsible for a deductible. So each time you're admitted, you'll pay approximately $1,400 for each admittance. Now, be aware that that will change over years, and it's not exactly that amount this year, slightly less than that, but it's about $1,400. Once you're in the hospital, they begin to pay all your expense until you've been in the hospital for 60 days. Once you've been hospitalized for 60 days, and that doesn't necessarily mean in a single visit, it could be concurring visits, they then begin to charge you a copay for each day you're there. So from day number 60 to day number 90, it's about $350 each day. And then when you get from 90 days on, then it doubles that again, so it's about $700 a day. So if you're to have a long hospitalization or multiple hospitalization stays, then it can become very costly once you pay your deductibles and if you're paying those co-insurance. Let me give you an example. We have a client of ours that went into the hospital about a year ago, and he was diagnosed with a tumor on his brain, and they come to find out the tumor was cancer. And so he was admitted to the hospital. They did the surgery and they removed the cancer. And actually, that portion of the surgery went very, very well. They did some radiation as a result of that treatment. Unfortunately, he got an infection when the surgery took place, and that created a tremendous amount of complications. And he ended up staying in there continuously for 106 days. When he was released, his total hospital bill was over $2 million. He would have had to pay, if he was on original Medicare Part A, the $1,400, that original deductible, when he was admitted in the hospital, and the $350 and then $700 per day from the 30 to 90, then the 90 plus. His total out-of-pocket expenses would have been in about between $28,000 and $30,000 would have been his portion of that hospital bill. Fortunately, he had some other options besides original Medicare only. But so that gives you an idea of what original Medicare Part A hospitalization does for you. It does provide for your hospital costs, but it does have a deductible for when you're admitted, and it does hold those co-pays after 60, and then they higher double that after 90 days. You can go to any hospital, and the premium, there is no premium. Now, if I was an employee and I had a group health plan by my employer who was paying for the majority or all of my premium, I would consider staying on the group health plan past 65. Go ahead and enroll in Part A only because there's no additional premium. And then the hospital coverage under Part A and my group health plan through my employer would work jointly together, and if I ever had some type of a medical issue like one I just explained, the two of them would pay in combination with each other, and you probably wouldn't have any bill at all. So Medicare requires that you enroll in Medicare Part A and Part B when you become eligible, unless you have credible insurance. So your employer's plan is credible insurance, so you can stay on that if it's available to you. Later on, when you finally decide to retire, maybe you are still working for that employer, then at that point you would have to enroll in the Part A and Part B. And as long as you're enrolling at the time you lose your credible insurance, there's not going to be a penalty. Now, if you choose at 65 not to enroll in Medicare at all and just run the risk of insuring yourself, and then you decide to enroll later, then once you enroll, then you'd be paying a penalty the rest of your life, which is an additional premium as a result of late enrollment. So make sure you enroll when you're 65 unless you're continuing some type of credible insurance, and then making sure you're enrolling later when that credible insurance is no longer available, such as when you retire from your employer. Okay, so that's Part A. Part B is the portion of the Medicare that pays for the doctor's outpatient surgery. You're not been admitted to the hospital, but you may have an emergency situation when you've got to the hospital and they don't admit you, and then they release you after they've had you in the emergency room for a while. So that's going to be covered by Part B. Your medical equipment like wheelchairs or other things, outpatient surgeries like, hip possibly could be done on outpatient surgery. Certainly there's lots of surgeries, procedures that they're now encouraging to go in and do an outpatient where you go in and have the surgery and then send home to recover. And that could also include something as extensive, maybe chemotherapy, where it's something that's going on for a long, long period of time, but you're just going into the hospital for the treatment and then sending you home. So under Medicare Part B, that covers those other expenses that are medical expenses, there is a premium, and that premium for most people will be about $135 a month. Now again, that premium is based on the amount of income that you make, and so it may be higher for some people that are in the higher income brackets, but for most of us it's going to cost you $134 or $135 a month, which they will either bill you if you're not receiving Social Security, or it can be deducted from your Social Security check. Same thing is true with Medicare Part B. If you have a group, as with Part A, if you have a group plan and you decide to delay enrollment in Medicare, you can do that as long as you have that credible insurance. But once you lose that credible insurance, you got to make sure you enroll in Part B as well. Now, Part B also provides the medical expenses as you receive these services from the doctors or the outpatient surgery, but you do have an annual deductible. So at the beginning of the year, you will pay all the expenses of your medical treatments. That's not hospitalization, but the deductible is very low. It's only about $164 a year. So it will continue to increase slightly, but it's a very low deductible, and I don't think most people would have a problem with that low deductible. So if you go in and see a doctor, you would pay the first $164 for that year. Then after that, then Medicare will start to pay the portion of it. But the summary I'm giving you is very general. So I would suggest you go to Medicare.gov if you really want the exact numbers of the deductibles and so on and so forth. But what Medicare Part D does do, though, is it pays the rest of the bill after you pay 20% of allowable charges. So if you go in to see a doctor and he bills Medicare a certain amount that's allowable to bill, let's suppose Medicare says what's allowable to bill for a doctor's visit is $100. Well, Medicare will send them 80. You pay the 20%, which is $20. The Medicare payment and your payment to the doctor would pay the total bill, and so that would be your portion. So basically, you got that annual deductible, and then after that, you're paying 20% of all the other bills of the allowable charges. Now, there is a challenge with Medicare Part B. There's a couple of challenges. Number one, the first challenge is that 20% that you're supposed to pay goes on forever. So if you're doing an extensive outpatient surgery, like a hip replacement, it's not uncommon for those surgeries to be $70,000, $80,000, $90,000. And so if you're paying 20% of $70,000, $80,000, that's a sizable amount of copay. And that's something you'll have to pay, and then Medicare will pay the rest. That's one issue. The other issue is with the original Medicare, you can go to any doctor you want to go to as long as they're willing to take what Medicare will pay them. So as I mentioned, there's an allowable charge. So you may have a doctor whose office visit bill is normally $180, and maybe Medicare's allowable charge for that particular visit is $100. Then they will only send 80% of the $100 or $80 to the doctor. You pay the 20. That means the doctor is being shorted what he normally bills by quite a bit. The doctors can accept you as a patient on a one-by-one basis. So you could go in one day, they could accept you, but you could come in a week later and they may not accept you as a patient because they don't want to accept that payment that Medicare will provide. You just need to be aware that many practices have to, either they don't accept any Medicare patients, or they'll limit the amount of patients they have that makes up their practice. So maybe they'll only allow 30% of all their patients to be Medicare because they feel like they can't provide income necessary to pay their expenses if everybody's on Medicare. So they may accept you at one time, and they may decide no longer to accept Medicare patients. You are able to go to any doctor, though, that will accept those payments. There are doctors, though, that are not contracted directly with Medicare, and they can do what they call balance billing. So they can charge up to 15% over the allowable charge as a balance bill. And so you could be paying whatever bill they're sending to Medicare, you could be paying a little more that's being billed directly to you by the doctor because they're not a directly appointed or contracted Medicare doctor. As you can tell, with the 20% with no cap on that as a coinsurance, Medicare Part B can also leave somebody on Medicare with some sizable bills that are not going to be paid for by Medicare, and you'll have to pay out of your own pocket. I think that's a pretty good explanation of Part A and Part B. Again, it's important for you to be familiar with those benefits because you'll want to address what Medicare does not cover if you're concerned about large payments that you'll have to make out of your own pocket. And there are two options that you have in addition to the original Medicare, Part A and Part B. And those two options you have is you can add what's called a supplement or Medigap plan, which pays the portions that Medicare doesn't pay. So they can pay the deductible, they can pay the 20% coinsurance on Part B, they can pay the co-pays under the hospitalization. Those Medicare supplements or Medigap plans are sold by lots of insurance companies. There's many options. Medicare has made them define their plans with a generic description. Those plans are referred to Plan A, B, C, D through Plan F. In fact, they're introducing a new plan called Plan G. And each plan is designed to pay portions of what Medicare doesn't cover. The one that's probably the most common is Medicare Plan F, because Medicare Plan F pays for everything that Medicare A and B doesn't. They pay the deductibles, they pay the co-pays of the hospital, they pay the co-insurance for the doctors, and they even provide worldwide coverage, which original Medicare only provides coverage in the United States. So if you're on original Medicare A and B and you're doing some foreign travel, there's no health insurance for you while you're outside the United States. And so again, these Medicare Advantage plans, or Medicare supplement plans, will supplement what Medicare doesn't pay. Now, you need to remember that Medicare A and B is provided by the government. The Medicare supplements are policies are sold through insurance industry or through the insurance industry. They are regulated by Medicare, but they are not Medicare. They're supplementing, and they have health underwriting much like a life insurance policy does. So if you're enrolling in Medicare Part A and B and you're trying to enroll in one of these Medicare supplement plans, they may have some health underwriting questions, and they don't have to necessarily accept you as a client if you have poor health. So anyway, that's a very brief description of part for the Medicare supplements. That's one option to assist in original Medicare. There's another option. By the way, Medicare supplements will be defining and describing in more detail in a later video. Also, in that same video, we'll talk about the prescription drug coverage, which is Medicare Part D. And that's kind of complicated, so I'm going to do that with the Medicare supplement plans. The last option you have is what's called Medicare Part C or Medicare Advantage. Now, Medicare Advantage is plans that are designed by insurance companies but paid for by the Medicare plan or government. So basically what they're doing is Medicare is not providing the Part A and Part B benefits for you. They're giving money to an insurance company who has designed an Advantage plan. And so when you enroll in one of those, you still have to enroll in Part A and Part B in Medicare, but then you can opt for the Medicare Advantage option. And once you enroll in Medicare Advantage, then the hospitalization, the doctors and all those other services, and even the prescription drug normally is going to be included all together in a single program, a single policy. Now, these plans are designed much more like what you're used to when you've been insured through your employer. They're very similar to the group health plans that have been offered and you've been using for years. And I'll go into greater detail on those also in later videos. Well, it's wonderful to have an opportunity to visit with you briefly today about original Medicare Part A and Part B. Please be aware that it's important for you to go ahead and get enrolled in those when you're eligible for them. Certainly you need to enroll if you do not have a credible insurance elsewhere. Once you lose credible insurance, you need to make sure you enroll in Part A, B, and B as quickly as possible. And you can go to Medicare.gov to do the enrollment, or you can go to your local Social Security office to enroll in Medicare Part A and Part B. I hope this information was helpful. And again, I'll be addressing those two options to supplement Medicare as the Medicare supplement or the Medicare Advantage plan. Thanks a lot.